Hello everyone, I'm Dr. Esmaili Najjar, and in this video we want to talk about post-operative taping. After rhinoplasty and removing the external splint, now it's time for taping. Taping serves several purposes, such as reducing the swelling, keeps the cartilages and grafts in the right position, and prevents delayed healing. Actually, it's really good to stabilize the skin over the new nasal framework. Different surgeons have different techniques, but in my practice, I have a modified taping technique. By that, I hold the nose and try to prevent of sagging of the nasal tip and try to prevent of downward pull of the skin, and it accelerates the healing process of the nose. So let's see how I do the taping after rhinoplasty. Okay, to start taping the nose after rhinoplasty, I usually first place the first piece. I use the 1/2-inch tape for this purpose. First, I place that on the suppurative break. That is very important part of the nose. I usually very like that, and I know a lot of patients like this break. It gives a very good show of the nose after rhinoplasty. So the first piece of tape, I place that over that area. Usually at this step, most surgeons try to continue taping the nose over the bridge, but in my technique, I try to use a different one. I try to use a U-shaped piece of tape, and first I place that over actually above the nostrils, and for this purpose you should be just in front of the patient, because it is really important it be equal on the both sides. Okay, above the nostrils and over the nasal bones. I gently hold the tape, try to kind of crimp that over the nose tip. That helps you to prevent sagging of the nasal tip, and also try to stabilize the skin over the nasal framework. So in the third step, again, I cut a piece of tape and place that again over the first tape, I mean the suppurative break. In this technique, you can see this triangle of the nose tip, because I usually try to use the technique of the cap graft and sometimes the shield graft. With this technique, you will have a very good tip definition after the nose taping after rhinoplasty. So first on the nasal tip break, after that the U-shaped piece of tape, and the third tape again on the suppurative break. That stabilizes very well the skin over your grafts. So I continue taping, another piece of tape, and half of that on the previous tape and half of that on the skin. Very gently, do not use extra forces. Again, a piece of tape, half on the skin, half on the previous tape. And finally, the last piece of tape, half on the skin, half on the previous tape, and just stamp that before reaching to the nasofrontal angle. Just above the bridge is enough. So that is the taping technique you can use for your patients. You can actually access to the very good results. It's very good and easy to do, and at least I recommend my patients for using taping 24-hourly for the first months, and after that usually I recommend to tape the nose during the night and oversleep and remove that in the morning. They can replace that according to their skins every other day, and that gives a very good healing process for the skin. Also, after the third week, I recommend my patients to start massaging the nose very gently on the both sides and the nasal bones on the both sides, and also very gently over the nasal bridge. That gives a very beautiful curve for the patient, especially your patient is a lady, so that's very good for the profile and very excellent result will be achieved after this massaging technique. Also, cleaning inside the nose and irrigating by normal saline is really important to remove the debris and also the clots. And if there is any absorbable sutures, so you should keep it very clean. So massaging, cleaning, and taping are three essential steps to complete your results after rhinoplasty. Thank you for your attention.